Hello, ma'am.
Hi, hello. Good morning. It's morning over here in the US. It's very nice to
Okay.
meet you all. Thank you for joining.
Thank you so much for taking out the time for this podcast. And before we start with it, I would like to give your introduction to everybody else who's present here. Uh, so, Dr. Raji is an obstetrician and a gynecologist who graduated residency from St. Francis Hospital and Medical Center. She completed her medical school at Maharasthra Institute of Medical Sciences and Research and spent 2 years working on clinical and translational research at Birmingham and Women's Hospital and Tufts Medical Center. She completed her USMLE exams while doing the research, applied for residency, and is now looking forward to start practicing as an OBGYN. She believes that starting early and being a self advocate are of the utmost importance for success in this journey. We are really thrilled to have you with us here, and it's one of the first interactive sessions that we are going to have today. The rest of them have been just webinars, but we're very glad that you agreed for an interactive session. And I just want to ask, like, how was your journey as an IMG? What motivated you to pursue a residency that is overlooked as a bit competitive and surgical, and like what motivated you to be on that path?
Yeah, perfect. Thank you for the introduction. And thank you, everyone, again, for taking your time out on a Sunday to come listen to me talk. But flash like going back in time and looking at how my journey started. I was born in India, in South India, in Srirangam, Trichy. And I kind of grew up, a lot of my growing up initial few years were in the Middle East. So I've been around in different Middle Eastern countries, but mostly spent a lot of time in Qatar, Doha, Qatar, which is where my dad was working. And I was over there. And I spent a good number of years with, growing up, learning things. And then eventually, when it came for time to apply to medical school, I decided to come back to India, which is when I got into Mymar Medical College, Maharashtra Institute of Medical Education and Research in Talegaon, Pune. At that point, I was very new. I just knew I wanted to become a doctor from very early on. It was very clear I wanted to become a doctor and I wanted to be an OBGYN. It's not always easy to be able to know what you want exactly that early on, but I just knew, and that was helpful. But I know a lot of people struggle with like, what is it that I want to do? Um, but there are ways to help you figure that out as you go through medical school. You don't have to know when you join, like what I need to do, but I knew, which helped me, I think, in the long run as to, trying to stay focused as to what my next steps would be as I go along in medical school. So during my medical school, I definitely enjoyed my time there, had a lot of fun, learned a lot. But I knew that I wanted to train abroad. And one of the main reasons for that is my father was at that time still working in Qatar. So we used to visit him a lot. And I had grown up outside India, so I wanted to give it my shot, but I don't have any family or friends or anyone who's done this before that I knew of at that point. So it was all new. I was like, I don't know where this is going to go, but let me give it a shot. But at that point, I tried to see if I can do some clinical hands on experience in Qatar, which also provides some ACGME accredited programs, including OBGYN. And I spent some time there at Hamad General Hospital when I was visiting my father. And I quickly realized that that's not a good fit for me because it was just like very different culturally, and I don't think that is what I was looking for in terms of practicing and becoming an OBGYN. But the steps to do that are very similar. You have to take your USMLE steps. There are additional requirements for visa and stuff. If somebody particularly wants to know about Qatar, I will talk offline, but we're going to focus on USMLE stuff here. So when I learned I have to take USMLE too. This was when I was in my last year, my internship. When I decided to do this, when I learned that I have to give USMLE anyway, I have to take this horrendous, massive exam anyway. Why wouldn't I go to the US instead? Why should I settle? Which is when I started looking into opportunities here and what I need to do to get here. At that point, I learned that as a medical student, at the end of your intern year or until you're a student, before you graduate, you can get hands-on experience in the United States. And that's what I wanted to do. Like I said, I thought I wanted to go to Qatar, but you never know until you experience something, because you can look at things online, you can hear people tell you stories, you can, but do you like it? Is this what you want? Is something, and I know a lot times applying for hands-on electives and coming here and doing things can be very expensive, and it can be very demanding on financially and, emotionally. My dad was like, "You're going to the US?" Like, okay. I mean, that came out of nowhere. So it's a lot. It's not easy. It's not easy. It's not possible for everyone. But if it is possible, I think that is very important, not just for your CV and to be able to apply and match, but to ask yourself the question like, do I want to do this? Do I see myself staying away from my family and friends for X number of years to want to do this? And the answer is yes, many, many times, because there's a lot of advantages of doing this, which we'll get to. But when I came here, so how I came here was nobody helped me. No, I didn't know anyone, but I did apply online. I researched and I looked at multiple programs, literally Googled like elective opportunities for international medical graduates. Things have changed. There are institutions that help you. There are people who you know who can help you, which is all very important too. You should get what you can, is the most important takeaway point from this, is get what you can. But I applied and I was able to get into some really good institutions and some average institutions, which is also very important. You don't have to go to like academic big places to be able to get to where you want. But of course, if you can, you take that opportunity. But if you get something that's not so great on paper, but that is going to get you into the system, you should, because I had a combination of those, and that also gave me an experience in terms of like, what does an academic practice look like? What does a private practice look like? So I was fortunate enough to get 4 spots, which is when I decided to come here. And I really enjoyed my experience. That's as simple as that. I missed my family, but I was like, oh, this is how I want to practice medicine. Like, patients ask you questions. Patients ask you, what are my risks? What are my chances? I want you to tell me that. And I'm like, that's when I need to know that, because it's not just reading from a textbook and like having basic knowledge. It's more than that, which is very challenging, but difficult, sometimes annoying. But you learn to be better by doing that. So I was like, you know what, this is what I want to do. And then I, at that point, had not taken any of my steps, not done anything. So I packed up back after my experience. But towards the end of my experience, I figured out that this is what I want to do. And I knew that I wanted time to take my USMLE. And I learned that I don't want breaks in my CV. So that's when while I was doing my rotations, every single place, I asked for 2 things. One was I mean, obviously you have to do your best and you have to impress them. So one thing I come across commonly, especially attendings telling me now, is people ask for letters of recommendation without putting in the effort. And you can ask, what is an effort? But like just going a little beyond what is the bare minimum. Like if you're like expected to be there for sign out, and you're expected to round on your patients, you're expected to do XYZ, give a presentation, you don't stop there. You go a little beyond and be like, I did this presentation on a particular topic, but I saw this patient in the clinic with you. Can I write a case report with you? And it's not easy to write a case report in 4 weeks when you're there, but you're telling them that you want to do more. And you're telling them that you're really interested, which is how they, you know, it's the truth of the story.
Exactly.
Like, you have to, because I remember being in a big academic place. I was in Weill Cornell in Qatar, Weill Cornell in New York, Manhattan, when I did my rotation. And I remember there were Weill Cornell students rotating with me at the same rotation. And I'm like, how am I supposed to compete with people who were born and raised and know the system and do everything here? Like, I don't understand. But I did. I just thought, okay, if she's doing that, I'm going to do a little more, and I'm going to say, why don't I do the case report? And there are some people who's going to see that, observe that, and appreciate that, and there are people that's going to be like, I don't care, you're from India, I'm not going to give you importance. And I'm being very honest here, and that's going to happen, but that shouldn't stop you from what you're trying to do. And then you just have to go to the next person, because there are people who are here to see what you bring to the program or to the place. So while I was there, I made a very conscious effort to continue to try to gain trust. And basically, you are, which is what I told, being a self advocate, I believed I could do this, so I made other people believe that by showing in my best capacity how and why I can do that. So I told people, I would like to do research with you. I would like to do projects with you. Let me like stay, come early and round on these patients, and whatever I could do, and I did. And I was able to get my position at the Tufts Medical Center before I left, which was very helpful, because once you leave,
Hmm.
they have 5 people showing up every month. They're not going to. It's hard. Email, keeping that communication is hard. But again, this is not going to happen. It's not possible for everyone. But these are little tips and techniques that you can use. But I left and I had to work through my visa stuff, and I eventually came back. I graduated from medical school because I had taken a gap from my intern year. I finished whatever I had to finish, got all my certificates, and in like 2, 3 months, I came back. And when I was here, I spent a combination of two plus years where I took my USMLE steps, and I also applied for the match. And I, at that time, published, went to conferences, did a lot of things that really helped build my CV and contacts more than anything. Just people who can be like, oh yeah, I've worked with her. She's hardworking. She's good. We can give her a shot. Which I think really helped me, having that hands-on experience and the research. Even if I honestly didn't love research when I came here, I didn't know what research was. I was like, what is research? I've never done research in medical school. I did a project, but it was nothing like what I did when I came here. So, all of that really helped me like learn about it, but you don't have to love research. I think a lot of people are like, I don't even like research. Why do I have to do this? But this is not for the purpose of research. It's for the purpose of getting to know people and getting your letters and being in the US and figuring out if you actually like it. And I did that, and luckily I was able to match the first year I applied. And 4 years from now, residency is probably one of the hardest things. I feel like a lot of people only in your level, whoever is in the
Yeah.
audience, probably just thinking about residency, but there's a whole different mountain you have to cross once you get into residency, but you learn so much. It's amazing. I never regretted coming here or doing this, because every time I honestly had some difficult experience in residency, I always thought to myself that it's probably going to be worse in India. So let's go. And then I
That's good to think
and
about.
yeah, I graduated in June. I just took my exam for like my board exam for residency. And then I finally have some time off. So I was like, okay, it's time, because I always wanted to give back to people, but it's really hard in residency. It's so hard because you just have very little time for yourself. But I do want to help people, so I thought this is a great opportunity, and here we are.
Thank you so much for like having that kind of an attitude where you intend to give back when you're at that stage. And I hope your exam went really well. Talking about exams, like what are some of the test taking strategies that you would advise that people should follow, or something that helped you? Because USMLE, both step one, step two, step three, are exams that require a very longer dedicated period, and sometimes people get all anxious about it, or sometimes they just go all in. How to maintain that kind of a balance that people are able to like do well on their exams? Like, what do you think could help?
Yeah. Yeah, I've taken way too many medical exams at this point. It's I've realized that it's one thing is like what resources you need to use,
Mm,
what things you need to do, which is obviously important, and it's out there. Many people that I'm
mm,
going to be the 70th person telling you UWorld is the most important thing to study
mm,
for USMLE. But what I've learned through my time is I think we don't realize how what is an effective method to study, because I
mm,
always like open my textbooks and I read and read and read, I write. Okay, but like 10 days from now, you're going to remember that fact. And I feel like what I learned a lot of medical students use here, and some of you might already know this, um, is to use something called like spaced repetition,
mm,
and using flashcards. And it is
mm,
probably one of the most important things that you can do while you try to study, because it's not enough, like I said, to just read something and you will forget that this is we are humans, we are very smart humans, this whole group of people, but we're human beings, we tend to forget information. So we have to, and I'm still learning and telling myself, because the hardest thing is to make those flashcards. Do not go and like use a deck that somebody else created. You have to make your own flashcards, because you know what you are going to forget that somebody else might not forget or remember. So taking that time, flashcards is basically you have a question and you have an answer. You don't see the answer. You, when you're studying, you prepare the answers, like you write the question. You can use Anki, you can use something called Note. There's a lot of free online apps that help you do this. And you can also use paper and pen if you do not have the access to apps. Um, and once you finish studying it, the next morning, if you're doing a dedicated study time, you wake up and you revise those flashcards. You ask yourself, you don't look at the answers and you ask yourself questions. It is very frustrating to do, I'm not going to lie, because it's easy to read. It's easy to read because you're just reading. You're like, oh, I know all this. This is so easy. I've read all this. But then when you're asking yourself the next day and you don't know the answer, you are frustrated and you're annoyed with yourself, because you're like, you should know this. I spent all this time yesterday studying this. But that's the hardest thing to do, because you don't want to revise. You want to just keep reading, because you're going to get a satisfaction that I'm studying more. And you're like, I just did this yesterday, I'm not going to forget it. But you forget it. So I think flashcards is something that I'm still learning and trying to incorporate into my own studying. And I think I really wanted to put that out to people who are like trying to think about how to study. Um, and then you revise that 1 week from now, and you revise that 4 weeks from now. So you're like continuously telling your brain that you have to remember these facts. But once you're done with 4 weeks, you're going to know that somebody can wake you up from their sleep and you're going to be like, I know the answer to this biochemistry question that I never want to think of again. But that's one helpful tip. And the second thing is what I learned, which again many of you might already know, but something called the Pomodoro technique, which is basically giving like in a day, if you want to study focused for 4 to 5 hours. I don't know how you guys are, but I cannot do that. I tend to like at the end of like hour, I'm like exhausted. I'm like, what is going on? I don't know what to do. So it's basically a system where there are different time frames for it, but you can study for 25 minutes and you take a break for 5 minutes. So you set a timer and you start it for 25 minutes. In the 25 minutes, you're studying, you're making your flashcards, you're studying, you're doing whatever you need to do, and you are not getting distracted. Your phone is away and somewhere else, far across the room, and you are focusing on just studying. You can buy a little timer without any digital media in it. It's just one start and stop. because people use their phone to do that, and that just defeats the purpose. And once you're done with that 25 minutes, even if you have four more pages you want to read, you stop. You stop and you get up. You get up out of your seat and you go away somewhere. Take a walk, drink some water, eat something, do something, and at the end of the 5 minutes, you come back. And this is available for 25 minutes, it's available for 45 minutes, 50 minutes, multiple different options with longer breaks if you sit for a longer time. And I think that is also something that really helped me because it keeps you focused and you will get more done when you're more focused in a particular sitting. So I just wanted to make sure I bring these two important facts that really helped me in my preparation. And again, I'm still trying to keep it with my studying from here on out, because apparently it never ends. You keep studying, but that's something that I wanted to say.
Yeah. But no, I get that how active recalling is
Exactly.
so much better than just passively reading stuff. And I think this is something that Indian medical students don't really have in their culture to actually use flashcards or some other techniques. This is something that all of us will really, really benefit because this is something that we don't have in our culture to study like that. We have been told to sit 8 hours, study and read. But these techniques, I think, will really help these students and me as well, because to be very honest, they seem really productive.
Yeah.
Uh, Apart from that, we really wanted to ask about what helped you be a better candidate than rest of the IMGs for a very specifically like surgical uh, position, like an OBGYN residency. Like, what is something that was very different in your application, or something that gave you an edge, or something that people should focus on if they want to pursue a very competitive residency?
Right. So I touched on this a little bit, but I truly believe like being here and being in contact with someone who is going to be able to write that good letter for you, which I understand is not possible for everyone.
Mm.
I do strongly think that is what helped my application the most, because I was able to, you know, it was one thing for me to like write emails to people, which I continued to do before I came here, but nobody like it was not as effective. But once I came here and I took my time to to take just take the time to like interact with people and explain to them what my goals are, what my wishes are. And it is interesting because, in the meantime, when I applied and I got all my like like publications and stuff, it was during one of those, because when I applied, I was scared. Like, it's so unpredictable. You're like, I don't know I know I spent all this time in these big institutions, but what does that mean at the end of the day? Am I going to manage? It's nothing, there's no guarantee until you get that letter that says you did. Even the people who said, "Oh yeah, I'll write you a letter," but okay, is it
Mhm.
strong enough? You're going to be like, I'm never going to get to read it, because you can
Mhm.
choose to, but you shouldn't. You should have it anonymous. So that's what is considered strong. Um, so in that setting, I think when I did a research project and I actually went to one of the ACOG conferences to do a poster presentation, that is when I met my program director, who eventually gave me an interview and agreed to take me. So by this, what I'm trying to say is just being in the country and doing stuff that people in India unfortunately cannot do is what helped me the most in my application. That I'm not saying people who don't come here never match into residency. That's not what I'm saying, but that's what helped me the most. Because especially in a competitive specialty, for some reason, I was the only foreign medical graduate in my program. Like, I was the only one who graduated. So they're not I feel like there are some specialty that is more IMG friendly.
Mhm.
hospitals that are more IMG friendly, but mine was not necessarily one of them. And I don't think they do it on purpose. They don't be like, oh, I don't, people just don't apply. People don't, their applications don't even reach them because they like don't know, and the scores, like everything gets filtered by the time they get to you. And it's like, what can you do? You don't know what's going on in the background. And I felt like when I interviewed, nobody looked at me necessarily differently. I mean, once I got the interview, I was like, oh, okay, you're a candidate like anybody else, which is nice, I guess, at the end of the day. But I do think being here in person, putting in the effort and work, showing self-advocating for myself and telling people why I will be a good fit for you, for this program, for this country, just like kind of vocalizing that multiple times. It can be annoying, but I mean, how are they supposed to know? Because apparently I've heard a lot of people fear that we'll come in and we'll run away or whatever. I don't know if this is true, but then I'm also like, we're all adults here. Nobody's gonna run away. But if they choose to run away, that can happen to an American, that can happen to an Indian. That doesn't matter who's doing it. But apparently, it's helpful to show that I've been here for the last 2 years. I did research. I'm doing all this. I can continue this for 4 more years because the last thing a program wants to do is lose someone. They don't want to lose a candidate, and that's why they like to keep people who like to stay within their with like they won't go because they have family here or whatever XYZ reason. But that shouldn't stop you. And I think if you can apply for electives, if you can do it, try to get a research position, come in and spend a lot of time with the people who's going to write your letters. That when they write your letter, you're going to be confident it's going to be good.
I get you're emphasizing on how it's very important for IMGs to network and connect here with mentors in the US, because obviously there will be a difference if you are actually working here. So while you were like here for 2 years doing your research, what kind of difference did you feel in the healthcare in India versus US? Would you like to highlight something about it that would be beneficial for IMGs who are coming for either research or electives in US?
Yeah, sure. I think even when I did my electives, I quickly realized it's very different. Um, and it's not one is better than the other because I don't think we should say that because it's very like we do a great job in India taking care of patients. But I do think it's different in the sense that I feel patients are more empowered, which makes you
More responsible.
feel more challenged and responsible because you can't just show up and it has something to do directly with literacy level. And if you work with
Mm.
like work in a rural area here, it's similar to back in India. But I feel like when patients ask you like what I should do or how I should do or why I should do, you should like know your stuff. It's beyond flashcards. It's beyond questions and you question banks. It's like, okay, these are questions that clinically are relevant and I need to answer these. So I think that was a big difference that I noticed in my training from there to here. And then I also think that, having like electronic medical records, being able to use Epic or the EMR system that you have to like navigate through to get to every information. Because in my hospital, I didn't have that. I used to write handwritten notes and handwritten charts and go down to the lab and get the blood work and all that stuff, which I thought having that was very different between the two systems. And um, I think being here made it the first few years were challenging in terms of understanding the system and learning everything. But when I transitioned to residency, I knew Epic. I was like, oh yeah, I know how to navigate things. And even then it was still little because it's clinical medicine is different from research. I'm not looking at 150,000 charts to like find their age and BMI and putting it into Excel. Here I'm like actually prescribing medications and doing things. So I definitely thought the way they practice medicine in terms of the systems they use to communicate is very different. And people don't realize how you will learn it. It's not so hard that you won't learn it, but it is the learning curve that I had to get through when I was practicing and getting ready to become one. And the third thing I would say is definitely like um, the team, how a team works is very different, because I do think in India there's like a very strict hierarchy as to like, I am your senior resident, I am
Mm.
your attending. Like, you don't ask me questions, you just do what I ask you. You just, and again, this is not all across, this is just my experience, because I still think there are programs in India that are probably better than some programs here, which is worse in terms of hierarchy. So it's like it's very varied. But
Mm.
my experience there, I definitely felt more like I could not ask questions very easily. I had to, this is probably my own problem that I was dealing with. But once I came here, I felt more comfortable and confident in asking questions and being like, why are you doing that, or why aren't you doing that? I want to know. And it's very normal for people to ask those kind of questions to like a 90-year-old man who's been doing this for like 500 years, and he'll answer. He'll be like, this is why. And I'm like, oh, okay, well, now I know. Or he'll say, no, go
Mm.
read and come back to me tomorrow, and I'll go read that and come back to him tomorrow and like have a conversation. So
Mm.
I think that was very helpful in learning and growing together.
So it seems like a very healthy platform to learn and ask questions.
Exactly. Yeah.
That seems very helpful for people who are going for electives soon. Apart from that, you just like gave your residency exams. What are some things that you would advise incoming PGY1s for their residency? Like, is there something specific?
Um, it's interesting when you get that match letter and you're done and you're like, oh my God, I worked so hard to get here and this is it. This is great. But then the real life hits and you're like, oh, now I have to pack and move and start a new life in this
Mm.
place I've never been. It's very exciting, but it's also very nerve-wracking because you're like, oh, I don't know this place. Unless you have someone or you have friends or you have colleagues who are, from India and
Mm.
stuff. So it can be very daunting, but it's so important to remember where you started, why you started, and not let go of that feeling, because intern year is probably one of the hardest things I've done in my life. Like, not medical school, not residency after. Intern year is just a lot, and it's 10 times more for foreign medical graduates, because if it's hard for American medical graduates who have literally done this, like when I see medical students here in their third and fourth year, they are hands on, they're delivering placentas, they're doing things, they're writing notes, they're interviewing patients, they're actually involved. I mean, I don't know what your guys' experience. It is very, like, if they like OBGYN, they are hands on and they do everything. So becoming an intern is like, I mean, they find it difficult. So for us, it's like adjusting to a new environment, adjusting to a new medical system, EMR, people around you. So it can be very challenging, but keep your head up high. Don't forget to ask questions, because you might. I had this problem because when I was an intern, I was like, oh my God, if I ask questions, I'm going to be like, it's interesting, because I was like, oh, people are asking questions. This is so great. I want to come here. And I came here and I'm like, everybody knows these things because they're smarter than me. And it's, the famous syndrome everybody has, imposter.
Impossible.
Everybody has it. It's not, it's going to happen. They're like
Mm.
probably recognizing that it's going to happen and just being like, it is okay to ask questions, because nobody's going to eat you up. They're probably going to think you are still interested. You want to keep doing this. And that's one thing. If I had to go back in time, I would have changed and I would have been like, it's okay to ask questions. And it's okay to, have some hard days and you're like, oh my God, why did I do this? It's okay. That's going to happen too. And it's fine. When you're away from family, you're missing Diwali, you're missing functions, you're not getting the same food. But it does get better with time, because eventually you're going to make money, you're going to be able to bring your parents here, you're going to be able to go to India. So yeah, especially intern year, just understanding that there are challenges that I'm going to face, and it's okay, because there's also a lot of fun in the process. If anybody's like waiting to live alone, they live with their parents and like, I just want my own place and I just want to do my own things. There's a lot of joy too. It's like a very mixed emotion
Mhm.
kind of state, but just keep your head up high, remember where you started, and ask questions and seek help. They always ask for mentors. They're always like, who do you want to mentor? Just like pick someone. Don't even think too much about it. Pick someone. I like that attending for XYZ reason. And you can always change, usually in many programs, and you can set up a timing with them every month or every 2 months and be like, this is how I'm feeling, this is what's going on. And obviously they're not psychiatrists or therapists, but
Mhm.
they're people who will understand that this is hard for you and help you out however they need to.
That's really, really helpful. Asking questions and like being comfortable with having an imposter syndrome, which almost I think a lot of medical students have, like being comfortable with it, that we're just at a learning stage, we're just curious about things, and it's okay. We need to read something about it, we'll read about it. That's really helpful. I think people would be more comfortable about it, and incoming residents would be really, really comfortable with asking questions and understanding how there's a very cultural difference in the healthcare in both the countries for most of the places, not all. I wanted to ask you, what helps you stay afloat in the in residency? Like, what is something apart from medicine that helps you somehow like to like be fine in the residency chaos? If like you're in a surgical field and it could get pretty hectic at times, what is something that really like motivates you, helps you, and makes you feel fine?
Yeah, I mean, everybody has their own little something that keeps you, happy outside of medicine. And if somebody says no, please find something, because medicine is it can get very toxic, if for lack of better word, because of how things are in terms of like seeing death and blood loss and like a lot of disabilities and things that we don't see much once when we're preparing for exams or medical students, and then suddenly you see all this and you're like, very easy to take the blame on yourself and be like, I didn't do well, I could have done better, which is all very important traits for a good doctor. You need to ask yourself how I could have done better, but you should not let that overtake you every sense. But for me, what worked was I'm a Bharatanatyam dancer, so I love dancing. I like just love dancing to any Bollywood music, anything. That's just like, and I did learn and teach dance when I was in Boston doing my research. So every time I got a chance, to be very honest, I was so proud of myself for throughout medical school and preparing for residency. I danced a lot. Like I taught dance and I learned dance, and I was like, oh, I'm gonna keep doing this in residency. You just don't get the time. If you're post call and you want to dance, your body wants to sleep and wants to snack on things. So it's like very hard to keep that up. Every time I could, I would put on music and dance. I would like talk to my dance friends, and I would like put some random dance reels on Instagram. And, just like dancing is what really kept me happy. But I did talk to my family. I think that there's not been a day I've gone without talking to my mom on the phone. Like I will call her, she'll call me. Talking to her really helped me like just feel like grounded and realize where I'm from. And I mean, this is not everything. If it gets hard, it's not like, yes, I've worked hard, I've sacrificed a lot to come here, but if I don't like it, I'm gonna go back. It's fine. I have my whole family there. It's not like, because sometimes you feel like you're gonna embarrass people if you like, do anything against what you've planned for yourself. And you might, but that's better than, anything else that you can choose to hurt yourself. Um, and I had some friends in residency. I've always had, it was not easy for me to make friends, very close friends in residency, because I'm very culturally different. I'm I listen to Bollywood music. I'm just a very different person. And a lot of people, especially there are no IMGs in my program, and they like
Mhm.
didn't necessarily connect. All of us didn't connect as strongly, and that's okay too, because I had a few friends, and that was more than enough for me to like keep me going. And I met my now husband back then, and he was a huge support system for me too. So all of that kind of combined helped me through the 4 years.
Right. That's a really wholesome answer, to be honest. Having the support of friends, family, and being true to your interests and culture and knowing you are is really helpful. I also wanted to ask, how do you envision your career path after completing residency, and has this changed since you entered the program?
Yeah. So like I said, very early on when I was pretty young, I knew I wanted to do OBGYN. And I learned eventually I wanted to come to the US. But what after that? Like, okay, but what after that? Is there anything else? And like as a knee-jerk response or reaction, once I matched into residency, I wanted to do fellowship. Like I was like, that's the next step because I cannot stop. Uh,
Hmm.
but then I went through a lot of OBGYN related specialties are very focused. There's REI, there's urogynecology, there's maternal-fetal medicine. So they're all very like they almost take you like if you're an REI, you can't deliver babies anymore. If you're a maternal-fetal medicine, you don't see GYN anymore. If you're urogynecology, you don't see pregnant women anymore, which is great. People like that. People like to get away from OB because OB can be very stressful. But I wanted to do REI, but I quickly realized I don't want to do REI because I loved it. I just wanted to do it because that's my next step. That's like what I should do. I worked so hard to get into residency. I want to do fellowship because that seems like the right thing to do.
Hmm.
I realized that I actually like OBGYN in its like totality. Like I don't like just one part of it. And the reason I want to do fellowship is to impress myself, impress the people around me, and be like this, hot shot, which I then realized that it was not necessary. Like you can stop where you need to stop and like be satisfied. And I enjoy OBGYN in all aspects of it, and it can be stressful, but I'm happy taking on that challenge at this stage of my life, and I chose to continue doing OBGYN, which I think I have taken up a position in Massachusetts, and I will be starting soon in a month. But I do think that that makes me happy, and that's okay because if anybody is like me and feel like the need to do more, you can if you want to, but pause and ask yourself if you want it, or if your mind changes. A lot of people do tell me that if your mind changes down the line, you can still do fellowship. It's like a little more challenging in a different path, but it's not like you choose it and you're like done, and you can't do any better. You can do fellowship after too, but don't do something just because, just like USMLE. Don't do USMLE because everybody does it and it's so cool. Do it because you really think you will like that. Because if you are not happy, because that's the funny thing, like despite loving OBGYN and loving being in the US, there are days I'm like, wow, this is so hard. So if you don't like it to start with, I can't even imagine how you're going to answer to yourself why you did this in the first place. So um yeah.
I get that. But firstly, congratulations on your next step in the journey. And I really like that you're very clear on the path that you're choosing, even if it's the path that doesn't seem like the subsequent next step. Okay, medical school, residency, fellowship. So I think that comes with knowing what you want to do and just going right at it. And I think a lot of people will benefit from it because a lot of times we're just stuck in that rat race and we don't really know what is something that our soul needs for the next step. So I think that kind of clarity does help. And Thank you for like reaffirming that thought again.
Yeah.
I think I've asked you enough questions. Is it fine that we can take some of the questions from the chat box? Because I
Yeah.
think we've gotten quite a few. I'll just read them in the
Okay.
order that we've gotten them. So somebody is asking, Karthik is asking, should I go for a general surgery match directly after my graduation in India or home country residency in surgery? Which one will have more chances of getting matched?
Sorry, I'm going to repeat that question. Can I match into general surgery after residency?
No, they're asking that is it better for them to do residency in the home country, India,
Hmm.
or should they directly apply to the US general surgery residency?
Oh, that's a good question, but
Mm.
there's no straightforward answer to it. But if you ask my opinion, because I have heard two school of thoughts around it. Because some people say challenging surgical specialties, they want you to be, the more experience you come in with is great. And I've
Hmm.
heard other aspect of group of people or program directors who say you can do X number of years somewhere else. It doesn't matter because I want you to learn this system, which is very different from that system, even though a lot of concepts might be similar. But I would say, I think the way I would answer this is if you've already done your residency in India, don't think you cannot apply for residency here. But if you have not done residency, I would encourage you to use all your time and energy and focus and money to try to apply to residency here. So that when you come, you're a strong candidate. And if you're going to show a lot of gap because you, for whatever reason, you cannot come here now, then research is the best way to go in terms of solidifying your CV and talking about it in interviews. But you cannot do research, you cannot come here right now. Then you can do residency in India. I think because it's great. Because I mean, it's not easy to get into general surgery residency in India, but you have to ask yourself that question: what is feasible? What can I do? And if you can come here, just work on that because it's a lot. It takes a lot from you because what people do is understandably get like they get happy with their life in India and stop, which is fine. It's just there's nothing wrong about it. But then you should not have that regret that I could have done better. So I would
Hmm.
say work hard to get here.
That's exactly how it's supposed to be. There's another question by somebody who's interested in OBGYN and they wanted to know if doing a research position within OBGYN faculty is the only way or doing research with an internal medicine faculty would also work since there are so less opportunities.
I think any research will help in the end, for sure, because you are putting in the effort. But the question then comes to, are you meeting the right people? That's going to directly help you match. Because if you're meeting somebody from internal medicine who knows somebody from OBGYN who can connect you, then great. But or
Hmm.
it's okay, they will write a good letter for you too. But if you have two options in your plate, then I'll choose OBGYN. But if you only have internal medicine, then go for it because that's one of the most important things is to just grab what you can get and make the best out of that opportunity. Because there have been people who have turned their face at me the minute I said I went to medical school in India and never saw them again. And there are some people till today that I've done my elective with, wrote a letter of recommendation for my job. So there's unfortunately there are more people who's going to turn their face away. It's just the reality of the process. Um, but if you have an option, I would say choose the specialty that you're interested in to do research if you can.
Right. Um, Somebody is asking if you know places that offer externships in OBGYN for IMGs, or like, would you suggest some places that people should apply? Because a lot of people are asking how to get the research position, although you've answered like cold emailing and stuff works, but if there are certain ways or places that could help people who are interested in OBGYN.
That is that is that is probably one of the questions I get a lot too. And
Yes.
I wish I had an easy answer to it. And I definitely think a little bit of hard work and a lot of luck is what worked for me to get a position like that, because it should be available, it should be open. But I will say one thing, that when I did get my first position at Tufts, it was unpaid. It was like not like a huge name or a title or anything for me. The Brigham one was definitely a lot better, but that I got after I had all the experience from Tufts. So I think, if that is what is stopping you, then you should probably tell yourself, I don't have any research background, so obviously I'm not going to get like a fully paid, and which again financially can limit some people, but it was hard for me too. But I took up that position because that gave me my entryway into the
Mm.
system. But again, that's not answering your question, I know, but I don't know of any like place that openly offers research positions to everyone. Even a lot of people ask me, can you get me into Tufts? Can you do that? I mean, it's really, it's that's, and I want to, if I can, I would, and I want to, and I'm just starting my path. So I'll see what I can do to help in the process. But I do think it's something that you need to put effort, hope, pray, and something will work out. But I was all about cold calling, emailing, just going out, like asking what you all are doing something now by sitting here today. You all are trying to do this, but that's what I would do in a different, I would like type research positions in the US. So like, just go at it that way. But like I said, I did mine at Brigham and Tufts, and I worked at Real Cornell. So those are all places you can like start with. But I know it's not easy, and that's the limiting factor, but you have to trust the process and try.
And push yourself. In the end, it's all about a little bit about luck and more about how many places you apply and cold mail. I think that should motivate a lot of people to cold email faculty somehow. And there's another question. What do people in US think about the kind of research that's done in India? Like, if a person has a lot of research experience in India, does that give you an edge, or does having research in US only count as the kind of thing that they look in candidates?
I mean, a lot of that depends on the quality of research you've done.
All right.
Like if this is like a one case report of a rare case you saw in medical school that you published, which I know how hard you've worked to do that, so nobody should diminish that. But if it's that, they're going to be like, okay, sure, it's like not what they
Mm.
think is good enough. And I have actually seen the interview sheets that these people have when I interviewed candidates. Like it actually asks for how many years of research, where did they do the research, and what did they publish the research, and what type of research it was. So it's not just research. I did research for 2 years, but like all of these, they have scores and points that they give you, because that's how they try to make the system as equal as possible, and not thinking that this person is American, this person is Indian, versus like everybody on paper. Did you meet like an American student with zero research experience versus an Indian student with like a paper published in like, I don't know, a good journal in India is going to obviously stand out more. So I won't say research in India is not helpful, but I think it's the quality and the type of research you do. But if you ask in general which type of research is more, it's research in the US.
Got it.
Yeah.
See, like everything is on a spectrum. It's almost always about the quality of work that you put into it. And I think most of that will derive from whatever ma'am has told in the entire session. You should know what you are intending to do with your own skills, and do you really want to do it? Do you really want to go ahead with the things? And I think that we've answered most of the questions. If there is something that you would like to conclude, or would you like to advise something to the aspiring OBGYN IMGs present in this webinar, it would be really helpful.
I'm just going through the questions because I feel bad that some people don't get their questions answered. Can you please share your credential and year of graduation? I graduated in 2017 and I joined research immediately after and I did research for 2 years and I matched into residency in 2019. So I did not have any gaps in my CV and I do think that helped me a lot because a lot of people ask what you were doing in this time frame and the answer is I was studying for an exam and unfortunately they don't like that answer for whatever reason because I know studying for an exam is a full-time job but they don't like that. So you should be able to do something else. Um, can you tell more about the research you did? I was at Tufts. I was involved in a lot of clinical trials, big clinical trials, and I was a very small part of it, but I was involved in data collection, interviewing patients, getting their consent, getting their samples, and stuff like that, which was, very helpful. But I also did not get my name on any of these big name trials because it was massive. Like we are talking about cross states and whatnot, and I was a very small part of it. But I did at that point reach out to people, and I tried to get a project, a simple, easy project that I could prospective study that I did, and I was able to publish it with the first author. Me as a first author, which I think really helped me because all the clinical trials are great and you can talk about it, but this is the project that I could really speak about in my residency and, like what I did, why I did, and that really helped me. At Brigham, I did more like a little bit of bench work, which I learned about Western blots and all those things, which I had no exposure to. It was very interesting, but I never want to do it again. I'm not interested in that kind of stuff. I like clinical research more, and I did some clinical research too, and I got some projects published there. So um, it was all OBGYN. I did all OBGYN, GYN oncology related research. Um, oh, somebody says good pointers. I'm an OBGYN in the US. Thank you. Uh, can you please share your, oh, I did that. I don't know. Do I have time to do this or no? OBGYN residency in India, I think it's the same. People want you, the more experience is good, but and right now I hear that that some states like Texas is taking candidates without having to do USMLE directly as practicing physicians. I have not looked or read into it much, but if that's something is a good option for you, great. I find that very interesting because I don't know how I can practice in this country without having undergone the 4 years of training that I did, because that's what prepared me to be who I am in terms of just being able to do things the way this country likes. But maybe you learn in the job. So if that's an option for you, they're bringing it up for a reason. So you should definitely look into that. Oh, okay. Let me do two more. Um, how do you stay consistent, disciplined in our study routine? And one more, how manage living alone in the US if you have no family living there? Consistent and discipline is very hard. I, again, still struggle with it. I just took an exam 1 week ago, and man, that was hard because it's hard because you're like, when is this getting over? But I personally thought the Pomodoro flashcards and looking at the end goal, like, this is coming to an end. If it's USMLE or not, it's coming to an end. You're going to be done with that exam and you're going to have to move to the next step. And remembering and reminding yourself that there is an end to this grueling process sometimes. And even though it's hard, try to find fun in it. Try to like be like, wow, this is so important. Can you like imagine yourself being here, seeing a patient and them asking you this question and you're like, I know this because I took my time to study this and I'm smart. You are smart. That's why you're doing it. So that kind of stuff really helps me just like attaching it to the in the real time world. And then let's see. Okay, perfect. I can keep going, my friend says, which is great. Uh, yeah, Perfect. Somebody is agreeing with me. Love all that. Living alone in the US is hard. But I met my husband here. We got married. I have a baby now. And my mom is here with me helping out. Didn't have any of that when I started off. I'm not saying you're going to find someone here, but you might. And I think, again, like, you come here alone, but you don't have to be alone forever. So reminding yourself of that this is my time to shine. I'm going to try to do my best, get through my exams, get through this research, have fun. You don't have to like sit at home and like study 24/7. Like nobody can do that. You shouldn't do that. Go do something that's fun for you, meet people, make friends, and you might also be on the other side not alone, which is great. Um, okay, I think I got a lot. Let's see. Hi, doctor. Do you advise applying for surgery? I personally think that, I mean, I understand that there are competitive specialties, but the number of people who told me do not apply for OBGYN, you're not going to get into OBGYN. The number of people that told me do family medicine, do internal medicine, which are great specialties, very important specialties. I cannot do internal medicine for the love of my life. I cannot round on patients for 4 hours. But no, some people think OBGYN is crazy because why would you do that? But so it's all personal choice, but you should not stop yourself from a specialty because it's too hard to get into, because this is not just about US or not. This is about what you're going to do for the rest of your life. And you should, and in my opinion, I always told myself this when I was studying and preparing for the exam: if I don't get into OBGYN here, I will go back to India. That's what I told myself. The only backup I had was family medicine, because there is a route you can do OB after doing family medicine. You can do family medicine residency, do an additional year of training, and practice OB, which is super helpful. But I do want to say that it shouldn't deter you from the path. If you decide that you like IM more, or something else more, then sure, but don't do it because other people are telling you this is more difficult than something else, because that is very obviously seen in your CV. Because if you show that I did this, I did that, I did this, I did that, it's very clear that you're working hard, but you're not staying consistent. And they don't want to see that if you can help it. If you can stay consistent and focused with the specialty, true to the specialty that you want. I mean, every research, every publication, every letter I have is from OBGYN. And I think that really helped me a lot when I applied, because it shows that you want to do it. Thank you to everyone saying thank you. I'm very, very, very happy I was able to do this, because it I don't know. It's so when I didn't have a platform like this when I started. I turned out fine, but I do think having platform like this, having these conversations, taking the time out to do these things is so important and helpful and motivating, because you're like, is this even worth it? And you see somebody on the other side who's done this, and it's not like my life is perfect now. I'm going, we are all going through stuff. But career wise, I'm happy where I am right now. And I think hearing that and knowing that and is very helpful when you're in this journey, because I remember um, looking up like online and stuff. And like when I saw people share their success stories, that's when I was like, okay, I'm going to do this too. So I think that's very helpful. So keep at it. I think you're all doing very, very good. And no matter what you choose, no matter who chooses you, and what you do, you're going to be happy and you're going to be successful. And that's what's the most important, because you're all, again, very smart people. You've already done all the hard work, I think. And believe in yourself. I think that's my biggest advice, and advocate for yourself. If people say you can't do this, show them why you can do it, because you believe you can, then you can.
To be very honest, this was a very comfortably inspiring session, and a lot of people are really, really glad people are preparing for their exams and they're feeling very comfortable about the entire journey because seeing somebody on the other side of even residency and being this inspiring and motivating is really, really helpful for us as aspirants. And we're really glad and grateful for you that you took out the time to actually elaborate and answer all the questions that were presented. And we really look forward to whatever you do more in your life. And we hope we can somehow do justice to the kind of motivation that we got today. Thank
Yeah.
you so much for your time, ma'am.
Thank you again, and don't forget as much as possible to once you reach where you reach to continue doing this for others because I it's hard. It's very hard to do that. So you forget. You
Mm.
do because one of the questions I was thinking about, what are the resources you used for step one? And I'm like, my God, what are the resources I used for step one?
Six
But
years ago.
still looked at my biostat section from my first aid to prepare for my board exam, ABOG board exam. So it like never ends. You still don't throw your first aid away. It's very good. But like, things change. There's probably something new. I use sketchy micropathoma, first aid, UWorld, but there's probably like new stuff. It's been like 7 years, oh my God, since I gave USMLE. So, but it's like it's super scary, but you're going to get on the other end. But do not forget to give it back to other people. And I'm so glad. Thank you so, so much for this platform. I think it's really helping people a lot and keep doing you. House of USMLE is such a great platform. And I'm glad I had the time and I could come do this little inspiring session for everyone. So whoever is studying for exams, all the best. Good luck. Keep pushing. You can do it. And have a good rest of your Sunday.
Thank you so much, ma'am.
All right. Thank you.
Thank you.
Bye.
Bye, ma'am. Thank you.